right now to get more people vaccinated, because we have, as a city, been a leader in this area. We continue to be leading in this area, and this vaccine hesitancy question is something that, as a country and a state and a city, is going to be our next big challenge. When we talk about what's the next big challenge for Long Beach, our next big challenge is going to be how do we hit 75% of the population. And it's going to take some creative innovation. And so I've been encouraging folks, if you think we should put everything on the table. And whatever ideas are out there for us to get more people vaccinated, every person that gets vaccinated is an additional safety measure put in place to protect the greater population. So we have to just get more thoughtful about what we do, whether we are encouraging folks to get vaccinated in certain ways, which is starting to happen on the East Coast in a couple places. So if you have great ideas, send them our way. I'm going to be reaching out to a lot of folks and asking that question. And if you've got the right idea, please let us know. Lastly, and that's going to be, by the way, the single most important thing we focus on, at least from my end, over the next couple months. It's the big challenge. It seems like an understated challenge because we've done so well, but we can't end up in a situation where 40% of the population is not vaccinated, of eligible adults. That will keep us on a loop of not ever beating this thing, and so we've got to do better. Lastly, I'll just add is we are just completely overwhelmed, and just want to say thank you to everyone that's donated to the book and toy drive. We've had over 9,000 items donated, which is amazing. Not only right now, from what I understand, are the kids, they have a library to pick books from and toys there to welcome them, but as children are moving out of the center, they're also getting a stack of books and other things with them on their way out. So it's really great. Just as a reminder, the drive ends on Saturday. So if you right now, I know of multiple schools and organizations that are doing their own toy drives or their own book drives. Please get all of those books and toys to one of the drop-off centers this Saturday at the latest, because that is when we are ending the drive, so that we can get everything into the center. So thank you again. And I want to turn this over to Dr. Davis, who will also give an update, and then if there's any questions, we'll do that. Thanks.
Thank you, Mayor. Good afternoon. Today I'm going to discuss the importance of getting vaccinated, as well as provide highlights of the updated health order. So like I've said before, vaccinations are key in our fight against COVID-19, and I encourage everyone to receive the vaccine to help stop the spread and protect public health. Each of the 3 approved vaccines, Pfizer, Moderna, and the Johnson, have proven to be highly effective in reducing your risk of severe COVID-19 illness and death. These vaccines do not give you COVID-19. The Pfizer and Moderna vaccines are a 2-dose regimen. It's important that you receive both doses in order to get the maximum protection against the virus. The first dose primes your immune system, and the second cements your protection. One of the biggest challenges on the horizon are variants. But if every eligible person gets fully vaccinated, the virus won't be able to spread, and that will make it impossible for variants to form. So please get vaccinated and don't skip your second dose. Vaccines are available for everyone who is 16 years of age and older without an appointment at the Convention Center site from 11 a.m. to 5 p.m. Monday through Friday, and 10 a.m. to 3 p.m. on Saturday. Both drive-through and walk-up options are available. The walk-up option is ADA accessible. Vaccines are administered free of charge and have been provided directly from the federal government. So now I want to turn to the yellow tier and share some of the highlights of the revised health order that will be going into effect tonight. So effective starting tonight at midnight, the health order allows changes to capacity and operations following state guidance. Indoor capacity for some venues may further increase when all attendees are either fully vaccinated or attendees show proof of a negative COVID-19 test that was done 72 hours before attending. As a reminder, a person is considered fully vaccinated 2 weeks after receiving the second dose of the Pfizer or Moderna vaccines, or 2 weeks or more since they received the single-dose Janssen vaccine. Outdoor social and informal gatherings may operate at a maximum capacity of 100 people. Indoor gatherings are strongly discouraged, but are allowed up to a maximum of 50% capacity if you're somewhere where capacity limits exist, or 50 people, whichever is fewer. Bars may operate indoors and outdoors, either at a maximum 25% capacity or 100 people, whichever is fewer. All patrons must remain seated. Restaurants may operate indoors and outdoors. Indoor capacity is limited to 50% of the maximum occupancy. Gyms and fitness centers may operate indoors and outdoors, with indoor capacity limited to 50% of the maximum occupancy. And indoor spas, saunas, and steam rooms may now operate. Indoor capacity for in-person religious services and cultural ceremonies limited to 50% occupancy is strongly encouraged. Movie theaters may operate with capacity limited to 50% of the maximum occupancy. Pools, spas, hot tubs, saunas, steam rooms, and splash pads may operate indoors and outdoors. Indoor capacity is limited to 50% of the maximum occupancy. Organized community endurance and running or walking events may occur with capacity limited to 500 participants per hour and no more than 1,500 total participants. Indoor seated live events and performances may operate following state requirements. For places that have a capacity of 0 to 1,500, the indoor capacity must be limited to no more than 25% of the maximum occupancy load, or 300 people, whichever is fewer. And for places with a capacity of 1,501 or greater, indoor capacity must be limited to no more than 10% of the maximum occupancy load, or 2,000 people, whichever is fewer. Outdoor live events such as sports or live performances may operate with capacity limited to 67% of the maximum occupancy. Private venues and events like meetings, receptions, and conferences may operate outdoors with a maximum of 200 people. Indoor private events may occur with restrictions. Institutes of higher education may offer in-person instruction limited to 50% of the maximum occupancy. Museums, galleries, aquariums, and botanical gardens may operate indoors and outdoors. Capacity is limited by the number of people that can physically distance 6 feet or greater in space. Outdoor equipment rental may operate. Capacity is limited to 50% of the maximum occupancy for electric boats. In regards to personal care establishments, piercing and tattooing services for the mouth or nose area may resume. Smoke lounges may operate indoors at 50% of maximum indoor occupancy. And lastly, wineries, breweries, and craft distilleries where no meal service is provided, may operate indoors and outdoors without serving meals. Indoor capacity is limited to 50% of the maximum occupancy, or 200 people, whichever is fewer. The health order is in place to reduce the transmission of COVID-19. I encourage you to visit the city's website at longbeach.gov/COVID-19 for more details. And business owners can call the city's BizCare hotline at 562-570-4BIZ, which is 4249, weekdays from 8 a.m. to 5 p.m. for more information. I want to thank you for your continued adherence to the health protocols and guidance, wearing a well-fitted face covering and getting vaccinated. Our smart choices are making a positive impact on public health. Thank you. I'll turn it over to the mayor.
Dr. Davis, go ahead and stay up there. The first question is going to be for you.
Okay.
We'll take questions from the media now. As a reminder, there is time for one question each. Additional media questions can be sent to the Long Beach Joint Information Center. First question comes from Haley at the Press Telegram. Haley, go ahead and unmute yourself and ask your question.
Hey, can you hear me?
Yes, we can.
Okay, great. So my question, Dr. Davis, is about vaccine demand. I know that that's something that was also mentioned at the last briefing. So I'm wondering if there's any hard data you can share on whether it's just plateaued or if it's dropped significantly, and if so, like which communities have been the most impacted with the drop in demand?
So there has been a drop in demand across the city, the county, the state, and the nation. And so we'd have to dig a little deeper to give you really good, accurate data, so we can do that for you. In general, it has been people of color that have been more hesitant than others. However, hesitancy crosses all races and ethnicities, genders, political affiliations. And so we're really working really hard to reach people where they are, making sure that we're out and about in the community, making sure that we're providing good education about the benefits of the vaccine, making sure that we're really monitoring the safety of the vaccine by encouraging everyone to sign up for VSafe, which is the CDC-run text-based follow-up of people who've been vaccinated, where you can tell the CDC directly what kind of symptoms you're having after you get vaccinated. And if you do have an adverse event, you can use the VAERS system, which you can Google, VAERS. And that's where you can actually, anybody, a doctor, a patient, a parent can put in if they feel like somebody who was vaccinated had an adverse event. So we're looking at it from an access issue, and then we're looking at it and making sure that we have that all done by being out in the community. And then we're looking at it from a hesitancy issue with making sure that we're providing really good information and dispelling myths and just making sure we have good, accurate information. And then just, making sure that we're following all of the protocols to get everybody vaccinated.
All right, thank you. Next question comes from Jason at the Long Beach Post. Go ahead, Jason, unmute and ask your question.
Hi, my question is for Mayor Garcia. So you, over the past few months, you've kind of taken on the title of vaccine czar. I was just wondering what plans you might have, ideas you might be considering to increase vaccine rates. Like today in New York, they announced that you can get free tickets to a Yankees or a Mets game if you agree to get vaccinated at the stadium. Could we be doing that like at the aquarium or other city sites to kind of get people to want to get shots?
Yes. So I think the answer is like everything. We should be thinking about everything. So we've actually been having these conversations a lot. I mean, in fact, just yesterday I had a conversation on this very topic, on the incentives with our health director, Kelly Colopy, and our city manager. So we are coming up. So I think strategically from the health department side, there are still folks, obviously folks getting vaccinated every day. And our goal right now is to really focus on getting these mobile sites up and running. We have a series of community partners that are out there knocking on doors And we're seeing, which was really great news. I heard that we're getting about 150, 200 folks that are walking up to these mobile clinics, that over the last few ones. So that's a good sign that people are walking up and using these clinics. So right now, like the goal in front of us is how can we feed people as much as possible into these mobile clinics and these mobile sites, these going door to door. I think something that you've seen in a few places in New Jersey and in DC and the East Coast is these incentive programs. So we are talking about that. And so I don't think that we should shy away from providing incentives to folks to get vaccinated. And whether that is tickets to the aquarium, which we've talked about, tickets, whether that is folks getting a free coffee, whether it's maybe it's New Jersey, or I was reading that you have a city that's where different pubs and breweries are offering a free beer with a vaccination stub. I think all of those types of programs have to be debated here. We're actively discussing them. I would imagine that over the course of the next few days, by next week, we're gonna have a program here that has to involve some type of incentive program. I strongly believe that, and the city team is actively discussing it and what would work for us as we move forward. So I support all. I think all those ideas are great ideas, and I think we're gonna have some that we're rolling out as well.
All right, thank you. That concludes questions, and we will now move on to Spanish interpretation.
Buenas tardes, Long Beach. Gracias por acompañarnos hoy. Hoy es nuestro comunicado de prensa para el miércoles 5 de mayo del 2021 con el alcalde Robert García y la doctora Anissa Davis, nuestra oficial de salud de la ciudad, quien compartieron información sobre la importancia de vacunarse y sobre la orden de salud de la ciudad. La ciudad alcanzó una meta importante esta semana, con más de 300,000 personas recibiendo al menos una dosis de la vacuna. Gracias a todos los que se han vacunado. El trabajo diligente de nuestro equipo del Departamento de Salud y los socios comunitarios ha sido extraordinario. Están haciendo un trabajo fantástico y estamos muy agradecidos por su dedicación. Gracias a nuestros esfuerzos colectivos para reducir la propagación de COVID-19, Long Beach, junto con el resto del condado de Los Ángeles, ha cumplido con los criterios para pasar al nivel amarillo del plan estatal para una economía más segura. Para pasar del nivel naranja al nivel amarillo, menos restrictivo, significa que la capacidad aumentará en una variedad de configuraciones a partir de hoy, medianoche o mañana, el 6 de mayo. Es importante tener en cuenta que algunas capacidades pueden expandirse aún más cuando los participantes o asistentes están completamente vacunados. Una clara señal de que las vacunas pueden aumentar positivamente nuestras opciones recreativas. El alcalde expresó que está muy orgulloso de nuestra comunidad. Felicidades. Y nuestro equipo de la ciudad. Muchísimas gracias a todos. Hemos logrado un gran progreso juntos y son noticias muy emocionantes, pero debemos de mantener precaución y seguir los protocolos de la orden de salud. Vacunarnos por completo y animar a amigos, vecinos, familiares y a toda la comunidad a vacunarse. Desde el día de hoy hemos tenido 53,025 residentes de Long Beach que han dado positivo por COVID-19. Hemos perdido a 933 residentes de Long Beach a causa de COVID-19 desde el comienzo de la pandemia. Nuestro programa de distribución de vacunas sigue fuerte. Hay amplias oportunidades para vacunarse sin cita y gratis en el centro de convenciones aquí en el centro de Long Beach. Además, el vehículo de vacunación móvil de la ciudad continúa llegando a los residentes que no pueden salir de sus hogares por causa de una discapacidad. Y las clínicas móviles de vacunas ofrecen vacunas 6 días a la semana en los parques locales. Aproximadamente el 58% de la población elegible 16 o mayor ha recibido al menos una primera dosis. El 95% de nuestros adultos mayores 65 y más han sido vacunados con al menos una primera dosis. Estamos trabajando con el Distrito Escolar de Long Beach para ofrecer vacunas a estudiantes mayores y padres y tutores en escuelas seleccionadas a partir de la próxima semana. Estas son clínicas solo para personas asociadas con las escuelas. No estarán abiertas al público. El distrito enviará más información sobre este programa. Las pruebas de COVID-19 siguen siendo importantes para monitorear la transmisión en nuestra comunidad. Y las pruebas rápidas de COVID ahora están disponibles en nuestras clínicas de vacunación comunitarias móviles para aumentar la accesibilidad. Las clínicas comunitarias móviles de vacunas operan 2 días a la semana en 3 parques de la ciudad. Admiral Kidd Park, lunes 3 a 5 y jueves de 9 a 11. Parque MacArthur, martes 3 a 5 de la tarde y viernes de 9 a 11 de la mañana. Houghton Park, miércoles de 3 a 5 y sábados de 9 a 11. Para más información y detalles, sigue nuestras redes sociales. Las pruebas son gratis y no se requieren citas. Esta semana también anunciamos que la Biblioteca Pública de Long Beach reabrirá 4 ubicaciones con capacidad limitada a partir del 18 de mayo. Las bibliotecas Billie Jean King Main Library, Bay Shore, Mark Twain y Michelle Obama reabrirán al público para visitas de hasta 30 minutos. Para obtener más detalles sobre los días y horarios, visite lbpl.org o llama al 562-570-7500. La doctora Davis lo ha dicho antes y lo sigue diciendo de nuevo. Las vacunas son importantes en nuestra lucha contra COVID-19 y seguimos motivando a todos a recibir la vacuna para ayudar a detener la propagación y proteger la salud pública de nuestra comunidad. Cada una de las 3 vacunas aprobadas, Pfizer, Moderna, Janssen o Johnson & Johnson, ha demostrado ser muy efectivas para reducir el riesgo de enfermedad grave por COVID-19 y hasta muerte. Estas vacunas no les dan COVID-19. Las vacunas Pfizer y Moderna son un régimen de 2 dosis. Es importante que reciba las 2 dosis para obtener la máxima protección contra el virus. La primera dosis prepara su sistema inmunológico y la segunda consolida su protección. Tenemos que protegernos de los variantes. Pero si todas las personas elegibles se vacunan por completo, el virus no se propagará. Lo que no permitirá es que el virus se mute. Así que, por favor, vacúnase. La doctora Davis compartió información sobre el nivel amarillo. A partir de hoy, 5 de mayo, medianoche o mañana, el 6 de mayo, Nuestra orden de salud permite cambios en la capacidad y las operaciones de acuerdo con las pautas estatales. La capacidad en interiores para algunos lugares puede aumentar aún más cuando los asistentes sean asistentes completamente vacunados o asistentes que muestren prueba de un resultado negativo de la prueba COVID-19 realizada 72 horas antes de la asistencia. Como recordatorio, se considera que una persona está completamente vacunada 2 semanas después de recibir la segunda dosis de la vacuna Pfizer o Moderna, o 2 semanas o más desde que recibió la vacuna Janssen o Johnson & Johnson de dosis única. Las reuniones sociales e informales al aire libre pueden funcionar con una capacidad máxima de 100 personas. No son recomendables las reuniones en interiores, pero se permiten con una capacidad limitada a un máximo del 50% de la capacidad. A menos que existan límites de capacidad o 50 personas, lo que sea menos. Los bares pueden operar en interiores y exteriores con modificaciones a un máximo de 25% de capacidad o 100 personas, lo que sea menos. Todos los clientes deben permanecer sentados. Los restaurantes pueden operar en interiores y exteriores. La capacidad interior está limitada al 50% de la ocupación máxima. Los gimnasios y los centros de fitness pueden operar en interiores y exteriores con una capacidad interior limitada al 50% de la ocupación máxima. Y pueden funcionar spas interiores, saunas y baños de vapor. Para servicios religiosos en persona y ceremonias culturales interiores son limitadas al 50% de ocupación. Los cines pueden operar con una capacidad limitada al 50% de la ocupación máxima. Las piscinas, spas, jacuzzis, saunas y baños de vapor pueden funcionar en interiores y exteriores. La capacidad interior está limitada al 50% de la ocupación máxima. Los eventos organizados de resistencia o carrera, como un maratón o una caminata de la comunidad, pueden ocurrir con una capacidad limitada a 500 participantes por hora y no más de 1,500 participantes en total. Se pueden operar eventos y presentaciones en vivo sentados bajo techo o interior de acuerdo con los requisitos estatales. La capacidad interior debe limitarse a no más del 25% de la carga máxima de ocupación o 300 personas, lo que sea menor. Para lugares con una capacidad de 0 a 1,500 personas y para lugares con una capacidad de 1,501 o más, la capacidad interior debe limitarse a no más de 10% de la máxima de ocupación o 2,000 personas, lo que sea menor. Los eventos en vivo, al aire libre, como deportes o presentaciones en vivo, pueden operar con una capacidad limitada al 67% de la ocupación máxima. Los lugares y eventos privados como reuniones, recepciones y conferencias pueden operar al aire libre con un máximo de 200 personas. Los eventos privados en interiores pueden ocurrir, pero con restricciones. Para escuelas o institutos de educación pueden dar instrucción en persona con límite del 50% de la ocupación máxima. Los museos, galerías, acuarios y jardines botánicos pueden operar en interiores y exteriores. La capacidad está limitada por la cantidad de personas que pueden distanciarse físicamente 6 pies o más en el espacio. Los negocios que rentan equipamiento al aire libre pueden funcionar. La capacidad está limitada al 50% de la ocupación máxima para barcos eléctricos. Establecimientos de cuidado personal se pueden reanudar los servicios de perforación y tatuaje para las áreas de la boca y la nariz. Los salones para fumadores pueden operar en interiores al 50% de la ocupación máxima en interiores. Y por último, las bodegas, cervecerías y destilerías artesanales donde no se brinda servicio de comidas pueden operar en interiores y exteriores sin servir comida. La capacidad interior está limitada al 50% de la ocupación máxima o 200 personas, lo que sea menor. Los dueños de negocios que tienen preguntas pueden llamarnos a la línea directa BizCare de la ciudad al 562-570-4249. De lunes a viernes de 8 de la mañana a 5 de la tarde para más información. La orden de salud está creada para reducir la transmisión de COVID-19. Visite longbeach.gov/inclinada a COVID-19 para obtener más detalles. También el alcalde mencionó su agradecimiento a todas las personas que han donado para los niños migrantes. Este sábado se terminarán las donaciones. Para más información, visite nuestra página de internet o sigue nuestras redes sociales. Muchas gracias por acompañarnos esta tarde. Y si van a celebrar el 5 de mayo, por favor, tengan mucho cuidado y siguen usando su mascarilla en lugares públicos con mucha gente. If you are just tuning in, I provided a Spanish translation of this press briefing, but when the live stream ends, it will be available on our social pages and you can rewind and watch again. Thank you, Long Beach, and have a nice day.